Hi ma'am, what is IUI?
Okay, IUI is nothing but it's an intrauterine insemination we do for the couple who are struggling to get pregnant. After initial investigation, when we find there is an unexplained infertility, when the one-sided fallopian tube is blocked, or when there is a mild endometriosis, or when there is a severe vaginismus, then that time we advise for a IUI. Or in case of a mild male factor infertility also, we advise for IUI. In IUI, what we do after semen processing, we transfer the semen into the uterus, that is intrauterine insemination. So this is called as IUI.
Okay ma'am. How much time is required for insertion?
Okay, so once a couple comes to the hospital and they give the semen sample, so semen takes about 25 to 30 minutes for liquefaction. Sometimes it may extend to 45 minutes to 50 minutes for liquefaction. So without liquefaction, we can't further proceed for the processing. So the process after that, the processing methods are two types. Either it can be a step-up method, either it can be a density gradient method. And these two methods depends upon the sperm parameters like motility of the sperms and the morphology of the sperms. Depending on that, they'll decide which method to be used for the particular couples. And once they decided, example, there are two methods as I said, swim up method. If the motility is less than 40%, the time required is about particular time. If it is more than 40% the motility, then the time required is less. But on an average, for a swim up technique, it requires about 45 minutes to 1 hour of preparation. Whereas similarly for density gradient method, it takes about 1.5 hours to 2 hours for the preparation. So on an average, it takes about 2 to 2.5 hours for the preparation of the sample.
Ma'am, after the insertion, how much time I should take rest?
Okay. So once the sample is ready, as early as possible, if we insert into the uterus, it is good. And once it is inserted into the uterus, at least minimum 15 to 20 minutes you have to take rest. And after that, you can resume your routine activities. Further rest at home or any restrictions of your activities is not required.
And I have doubt ma'am. What time I should get result?
Yes, once the IUI is done, after 2 weeks, either you can do a pregnancy test at your home or you can do a beta HCG test to confirm whether it is a positive or negative results. For any IUI procedures, the success rate of IUI is about 15 to 20%, that's all. Okay, so for any couple, we advise about 3 to 4 cycles of maximum IUI before we go to the next step.
Thank you ma'am.
Thank you.